I have with me today Alicia Osborne Worrell, a frontline nurse in the United Kingdom. Hi, Alicia. Thank you so much for joining us here today.
Hi, Kobie. Thank you for having me.
So just tell us a little bit about yourself, how long you've been in the UK, and how long you've been working there.
So I've been in the UK for 16 years, 17 years. I've been working as a nurse here in the UK for 16 years now. Overall, I've been a nurse for 19 years. I passed my registered nursing from the Barbados Community College in 2001. Previous to that, I was a nursing assistant since 1996. So I've been in health for a fairly long time.
Wow, a long time. And being in the United Kingdom, we've been getting a lot of stories and a lot of, we would have realized that we would have passed the 10,000 mark in terms of deaths from the COVID-19 in the United Kingdom. As a frontline worker, what is the general climate like in the UK now in terms of hospitals?
Well, I think the general climate is fair overall. I think not only in the hospital, I think in the public as well, general public. Fair a lot so for nurses as well and healthcare professionals, because this is a new illness and we are learning about it every day. So fear, I would say, is the biggest thing. Not knowing if you're going to be safe, not knowing if what you're doing is safe, and that kind of thing. There's also a lot of frustration, I think, and that might come because of maybe lack of the appropriate PPE, or feeling that you're not supported or understood in terms of how you feel about the illness and the general feeling around what's happening at this moment in this crisis.
And being on the front line, you know that there have been some worst case scenarios where we've also recorded deaths here in Barbados as well too. And we've been told that it especially affects the elderly. What are some of the cases that would have been in your general area or in the hospitals that you work at that you would have seen that would have been really heart-wrenching or touched you in a big way?
Oh dear. Rightly so, yes, it does affect the elderly population more. There have been a few younger persons who have died from this illness as well. But as you can imagine, as an older person, you will probably have more comorbidities or more chronic illnesses that might make you a little bit more susceptible to any other illness that might come along, because your immune system might be a little bit more, compromised, or your body systems might already be burdened by or damaged by another condition. So in that regard, it has been affecting the elderly population a little bit more than it has been other populations or other age groups.
And we've seen here in Barbados that the cases that would have been recorded for deaths have also been elderly persons. And we've also seen as well too that some people may not be still at this point taking it as seriously as they should, in relation to they may be caring for an elderly person, or they may be in a house with an elderly person. What advice would you give to those people who still aren't taking it seriously in light of the virus really affecting more seriously older people?
I would say nobody's invincible, and therefore, if you're not thinking about yourself and your health, think about that person that you have at home, that loved one, that grandparent, that mother who might have another illness that will make them more vulnerable to succumbing to this illness. And I think one of the things that affect me most, or I've realized most about this situation, is that people are dying alone. They're dying in isolation. And that must be one of the most difficult things that not only that person could face, but their family members could face as well, because it must be something that will stay with that family member for a long time. When you don't get to say goodbye to a loved one before they die, that stays with you, because you always feel that there's something that you could have said, something that you should have said, you know, either to make you feel better or to make that person feel better. You know, either whether that is to tell them that you love them for one last time, or to hug them, or to touch them, or, you know, and that takes away something from the person who is left alive to deal with for however long afterwards. So I think for me, the biggest thing, the biggest devastation of this crisis is that people are dying alone. People are dying in isolation without their loved ones close by. And they might have a nurse like myself or somebody else who might be there with them when they die, but that can't replace having their own family member, you know, by their sides.
And what impact has it had on you having to deal with these types of situations? Because we've been talking a lot about mental health for the persons who are staying at home, but I know it must be difficult for you as a frontline worker, being in the hospital, seeing all these people come through, maybe asymptomatic, and then they coming out having passed on. So how have you been coping?
Yeah, I think as a nurse, we kind of try to, or we're kind of trained in some way to separate ourselves from the actual event, or what's going on at the time. And I pride myself in thinking that I can do that quite easily. But what I've found is, you know, I've had patients who, or I've had one patient who died, you know, while I was taking care of her, and it really affected me more than I expected, because I've tried to think that I can remove myself from a situation until I'm by myself to deal with it. So for me, I've been coping, but there are those weak moments when it can take you by surprise when you weren't looking. And that has happened for me when I lost my first patient. It is never easy to lose a patient. But I think with all that was going on and all that's going on around us, and not, again, as I mentioned earlier, people not being able to visit their families as often and as for as long as they want to, and not being there for families, I think it affected me more, knowing that this person was going to be dying alone. And you know, I was there when she took her last breath, and it really took me by surprise, my reaction, because I couldn't hold myself back. And I think it made me angry, and I was frustrated, you know.
And in relation to also in your profession now, have you guys in the UK been experiencing the same difficulties as your counterparts in the US as it relates to PPE and being given the resources to combat this virus in a meaningful way?
Yeah, I think PPE is an issue all around, and it is more, for me, it is more so not about the amount of PPE, but the appropriate type of PPE. And there will be some confusion or disagreement on what PPE is most appropriate. And I think this is where the issue comes. So a lot of times they're asking about, oh, is there enough PPE, whatnot? That is not my issue. It is it the appropriate PPE for what we are dealing with? And according to Public Health England, they're saying we can wear normal surgical masks, etc., which I disagree with. And, you know, that is where the issue is. So there is lack of PPE, yes, but there's probably more the issue of lack of appropriate PPE, what we might consider appropriate as frontline workers who are dealing with suspected and positive patients. What we think is appropriate might not be what the higher accolades think is appropriate. You know, so I think that's where that confusion might come
And
alive.
I asked you earlier about the climate there. Being a Barbadian nurse and having strong roots in Barbados, you've been able to see the difference between the response in Barbados and the response in the UK, especially from the citizens' perspective. How have you found that? I'm pretty sure you've seen the videos or you've seen the news articles. How have you found that Barbadians have been taking the situation for COVID-19 as compared to the citizens in the UK?
That is a cultural thing.
Mm.
You know, the Barbadian society or the Barbadian citizens, the mindset and whatnot is very different from the mindset of the UK. And the UK, the citizens of the UK have been, I would say, for some time, have been, I don't want to say programmed, but have been trained to some extent to behave in a particular way, you know. And this comes, I guess, maybe with the fact that there's so much surveillance and cameras and whatnot, and people can always be, you know, accountable or found accountable for their actions particularly. But I think it goes more culturally. And yes, you know, Barbadians might not be taking it as seriously, or might appear to not be taking it as seriously. And that is probably because they don't see the numbers of people being ill and the numbers of deaths. What I would say though is that the way how the Barbados government and the Ministry of Health and Wellness has been managing the situation is, you know, extremely fantastic. And I want to, you know, say how proud I am to be a Barbadian at this time in relation to how they're managing this crisis. And there are two main things that I would want to highlight here about how they're managing it is that they've kept so in tune with what's happening in the international countries. Usually in the past, Barbados would take a few months or so to catch up to doing things, but they've been almost on point at the same time. And also, in terms of what I see the nurses wearing for PPE is on point, doing so much better than what they're expecting the nurses in the UK to be wearing with positive and suspected people. So again, kudos to them. But the other thing as well is the fact that they have separated their patients, their suspected COVID and positive patients from the general hospital. That has been, I think, one of the main and most instrumental things in managing this crisis, in that they have separate facilities where suspected and positive patients will go, that is completely separate from where the general public needs to go for their health. And I think that was a brilliant decision. And so, you know, I am very, very proud of how the Barbados government and ministry has managed the situation, the crisis so far, beyond par, beyond the level here in the UK, I would say.
And finally, any advice to Barbadians who may be listening to this program now as it relates to general things that they can do to ensure that frontline workers like yourself, because, you know, it may be more impactful hearing it from somebody in the UK. We've been saying it here in Barbados a lot, but any general tips for Barbadians as it relates to how they can help you as a frontline worker to make your job as easy as possible?
I think I would advise the public to stay inside. It's only for a short time. It's better to do it now, so that the quicker we can get back out into society and back to some level of normalcy. So if they adhere to what's being said now, it will make the quarantine less. You know, the time will be less, because the more they disobey, the longer the government is going to feel like they need to carry on this quarantine. And I would also say, and I'm a big advocate of covering your nose and mouth when you go into public spaces, especially for people who, as you mentioned earlier, have maybe grandparents at home, mothers at home who have comorbidities, and they're going out still, not listening, being disobedient, and not listening to the advice that's being given to them, which is going out if necessary. So if they're still going out, cover your nose and your mouth. It's not 100%, but it is something. It will give some reduction. Think about the person that you have at home, who's staying at home, who's being obedient, who's staying inside when you go out to come back to bring your germs inside. So, I don't want to. Prevention is better than cure, and I that's kind of one of my mantras. Prevention is better than cure. So best to try to prevent it now from something happening, and then you being sorry about it. So cover your face, cover your nose and mouth when you go out. Stay inside if you don't have to go out, and if you're going out because it's necessary, try to keep your distance, your physical distancing as mentioned, and wash your hands, keep your hands clean, and just follow the advice that they're giving you.
Well, thank you so much, Miss Alicia Osborne Worrell, a frontline worker in the fight, a Bajan nurse in the UK. Thank you for all of the hard work that you're doing over there, and thank you to the frontline workers here in Barbados as well too, and continue to stay safe.
Thank you very much, Kobie. You too.